Thank you, my good friend and respected industries senior president of MCCI, Mr. T.R. Keshwanji. We have got very respected dignitaries on the dais. Dr. Surendran, who is the chairman of Sankar Netralaya, Dr. P.V. Jayashankar, trustee and medical director of Sundaram Medical Foundation, Dr. Ayyappan Ponuswamy, who is the medical director of Kaveri Hospitals, and Mr. P.V. Jayashankar, who is the co-chair of MCCI Healthcare, all the Professor Sridhar, who came all the way to invite me, and all the industrial leaders, all the think tank, ladies and gentlemen. It's a privilege for me. I will be there for a short time, but because you are there, industry is thinking about the healthcare in Tamil Nadu. When I came to know about this concept, I thought I should be here, even if for a short while. Let me first of all share with you the happiness of the fact that Tamil Nadu has for many decades been in the forefront in the healthcare in the entire country. And at this juncture, before I start, let me just thank all of you, the industry, as well as the healthcare leaders in the private sector, for having done a wonderful job in helping the common public during the COVID epidemic. I, as commissioner, have seen the role both of you as the industry and you as the healthcare providers in the private healthcare, besides us who were all there. It was not we alone who were doing. It was a common job where we had all the sectors and your contribution was immense. I must say at this point of time that as the corporation commissioner, I was overwhelmed by the contribution of the industry in terms of coming day in and day out with aid to assist the government in its efforts. There was no week which was not there without industry coming to give us oxygen concentrators or medicines or reagents or even the workforce to help the corporation or the government. So let me at this point of time acknowledge and appreciate and thank all of you for your contribution over here. And your contribution is not ending with the epidemic. Your contribution continues, and that is shown by the fact that for the health care, you are having a separate seminar over here. We have called all the stalwarts of the industry and the healthcare sector. Tamil Nadu has always been there in the forefront, as I have told. Let me just give you an intake about the infrastructure that we are having today. We are having 36 medical colleges across the state, which is one of the highest in the entire country. I'm proud to say that the endeavor of the government is to have one medical college in every district. In some of the districts, we are having more than one college also, but 36 is a big number, number one. Number two, we are having nearly, for these colleges, there are hospitals attached in each college also. I have statistics with me. 62 hospitals are attached to the medical colleges. For example, Madras Medical College has got eye hospital, separate IOG, Gosha Hospital. Stanley College has got RSRM lying in hospital, etc. We have got 62 hospitals across the state. There are two super specialty hospitals of which we are proud of. One is Umam Durar Hospital, where we have got the most latest technologies in many sectors. In fact, the other day I was there, I was seeing doctors easily sitting in their computers and doing robotic surgeries, and the surgery was going on in the remote. I was quite surprised to see. For you, it might be something common, but for us, it was a surprise. Then, besides the medical colleges, we are having 37 district headquarter hospitals. There are, in addition to that, 256 taluk and non-taluk hospitals. I'm just trying to give you, for us it may look to be routine, but I should acknowledge the effort of the administration as well as the population and the government, successive governments who have built this robust healthcare system, because this is not there in every state. Tamil Nadu, in fact, we are lucky. In the north, many states may not have this sort of an infrastructure with us. We are having nearly 1,830 primary health centers across the villages, and we are also having 8,713 health sub-centers. There are urban primary centers also, 487 urban health centers. Just trying to give you the statistics saying that we have a robust healthcare system. And it is because of this robust healthcare system that today the number of OP cases that are treated across the governmental system alone is nearly 6,71,000 on an average every day. And every day inpatients, the bed occupancy is nearly 67,000 across our government hospitals. So it's a big system, and this is complemented with the private healthcare system. We are having the director of the Shankara Nethralaya, Kaveri Hospital, Sundaram Foundation, Apollo, MGM private healthcare system, where people fly in not only from the other states to get their treatment, but from other countries also, because of which Tamil Nadu is considered as the medical tourism capital of the entire country. So I must acknowledge at this point of time the contribution of the entire industry in taking care of the entire healthcare system. So at this point of time, I will just focus on two broad issues where perhaps industry has to contribute, where maybe the thought process can be there. The first point is how you can contribute, the industry can contribute. I will give you my wish list. This is for you. The first point is, the government is spending a lot of funds on the healthcare system. Every year, my NHM budget, state and central government budget alone is nearly 3,000 crore rupees. In addition to that, Tamil Nadu government has also put its money on infrastructure building across various hospitals, and nearly 1,600 crore is being invested in upgrading various hospitals. In addition to that, we are having many other schemes. So at any point of time, if you roughly calculate, projects worth 4,000 to 5,000 crores are taking up in the entire state. But is that sufficient? Will that suffice? I will say it may not suffice. We need the assistance of the industry in complementing the efforts of the government in improving our healthcare system. There are many aspects wherein we may not be strong. Government may be having funds because government is a big entity. But when it comes to finance, when it comes to extremely good critical healthcare, perhaps the government will also like the contribution of the private sector and the industry in complementing its efforts. I will give you first example of dialysis units. Dialysis units may not be very costly, but dialysis units do require a lot of close follow-up of the upkeep of those units and complementing it with the constant follow-up of that. So as Corporation Commissioner then and as Health Secretary now, I do encourage and look forward to the contribution of the private sector, especially the industry, in setting up dedicated dialysis units wings run by the industry in our governmental healthcare system and hospitals. I will be happy if the industry comes forward to put up dialysis units in various hospitals across the city, and more so in other parts of the state where there are no dialysis units, and people, as time goes, there are more and more of sugar patients, kidney failures are there. So we need more and more of dialysis units, wherein perhaps the contribution of the industry will be extremely valuable. This is the first aspect. The second aspect which I will like to feature out is adoption of maintenance of the hospitals. Unfortunately, where there are some plus points, some minus points. Government is flush with a lot of capital funds. Flush means the intention of the government always there to give a lot of capital inputs. But what we find lacking is the funding as far as the maintenance of the hospitals is concerned. Perhaps in this regard, if there is a public-private contribution and the industry also comes forward to assist the governmental efforts in maintenance of the wards, it will be very nice, because we are not expert, we are good in building new buildings, etc. But upkeep of the buildings, you go to a government office, you go to a private office. Of course, now we are also catching up. You can very well say the private industrial office is so nice and swanky. Government office may be a little normal, though we are also again trying to catch it up. I will like the governmental hospital system to be as good as the private. No, you should not. For example, today you go to Gindi Super Specialty Hospital, you will be wondering whether it's a super specialty hospital or is it a 5-star hotel or something. The ambience is like that actually. So, but this may be those which have come up now. There are many hospitals which will require some hand holding, some efforts. If the industry is okay, somebody may say, sir, we will take up the entire upkeep of RSRM hospital, which is there in North Chennai. This is a place where you have a lot of deliveries taking place, or Stanley Hospital, or remote areas, Vanembadi Hospital, Ambur Hospital. So this we will take care of their entire, we will ensure that the wards are painted, whitewashed, windows, grills are tagged. We'll give, the building is maintained by so and so hospital, the wards, you want to sponsor, you have got CSR funds, and you can do, and we can have a tie-up. That way you can adopt those hospitals for its maintenance, and build compound walls, etc. Those last mile connectivity that is required for the hospital, which actually will improve its ambience and hygiene, will actually not only be good for the eyes but also good for the hygiene of the patients. And more than the funds, it is the contribution, and your expertise is something that we look forward to. This is my second aspect. Third aspect, which perhaps I'm just trying to share with the industry, where though your seminar topics are slightly different in the health, but since it's organized by the Madras Chamber of Commerce, the government has actually now started laying a lot of focus on the hygiene within the hospital. In fact, I have written a letter to the district collectors that on an everyday basis, all the deans and the joint directors, etc., should visit two places. One, the laundry of the hospital. Second, the kitchen of the hospitals. You will be very surprised to know we focus a lot on the laundry of the hospitals. If I get admitted to a private hospital, they'll change bed sheets twice a day. But if I go to a governmental hospital, they may not do so. So Tamil Nadu government has written a circular. I have written a circular to all the district collectors that in every hospital, every ward, every day, the bed sheets should be changed, washed, cleaned, ironed, and then replaced in every governmental hospital. That is the first thing that I have told. And do you know what is the number of outpatients that are there in our hospitals, or inpatients that are there in our hospital? It's huge. In Chennai, for example, in Chennai MMC, on an everyday basis, there are 10,000 plus outpatients every day in the morning, and inpatients is huge in number. There are hospitals. The other day I went to Chengalpet Hospital. The number of beds over there are more than 2,000. And 2,000 patients, bed sheets have to be changed, pillows, covers have to be changed, washed, cleaned, ironed every day. We are improving that. Perhaps when you are adopting, you can adopt good, best laundry machines, etc., dryers, squeezers, etc., can be put in all our 290 plus hospitals and other medical colleges. That's another thing. I'm just giving you thoughts where the industry can contribute. You can adopt IOG, for example, Institute of Obstetrics and Gynecology. The industry can adopt its laundry and improve the hygiene. It will be useful for the poor mothers who come over there. They should have an equally good experience of the hygiene. The doctors are good, the staff is good. Because the ambience and environment also is something that we look forward to. Just because they are poor, they should not be suffering, and they should have equally good hygienic equipment. The third is, of course, the kitchens of the hospital. This is something that industry can absorb. So laundry, kitchen, ambience, dialysis machines. The fifth thing is those who wish to complement along with us in our journey towards making the hospital infrastructure more robust can also come forward to contributing machinery like MRI machines, CT scan machines in such hospitals which do require over there. CSR funds are there. Let me also tell you, sir, that I have been in touch, many of my own, I am an engineer, many of my engineering batchmates are at present heading the CSR units of various various industries across the country. They're all senior positions, somebody is CSR head of this in Hinduja and all, they're all my own class fellows, etc. Many of them have to actually struggle to find out good projects, and the money is sometimes well intentioned but getting wasted. I somehow feel that there is a gap between what the industry is actually doing and what the actual need of the day is there. What I will request Mr. Keshwan and your leaders in the industries, that please come and see the best for your CSR. I like you to link us up with various industries. Instead of you yourself deciding to take up some projects, please have your sitting, we'll give time, we'll give our wish list, like I'm giving my wish list over here, whether it's the right forum exactly or not, I don't know, but I'll give you the wish list, give you a wish list of the projects where we feel that we are on a weaker visit, and give you our thoughts where we'll require the CSR contribution to be there. Otherwise, I find that every now and then, there are now, whether you know or not, there are now middle level organizations, NGOs, etc., who just thrive on the CSR funds, who just take up some lakes, they do the desilting of lakes, whether they are, that is the most important lake in that area or not, I really have a doubt. Many times I have asked, why you did this? You could have gone to a better place. Why you didn't consult us? Sir, or some local vested interest. So the money gets wasted. So that's the point that I wanted to say. Another thought process in the hospitals, we have got now, for example, all the gynecological hospital or in other hospitals, a lot of patients' relatives comes, and we really do not, like in the private sector, we don't encourage too many patients along with too many guardians along with the patients, attendants. So we have waiting sheds, and most of the time the waiting sheds capacity is inadequate. So maybe waiting sheds can be also built up across the city. We need battery cars across various hospitals to take care of senior citizens or those people who are unable to walk, etc. So there are all small thoughts. I have given you food of thought where industry can actually contribute their bit in what we require in the healthcare. We don't require you to put up 100 crore, 200 crore, but there are gaps where you can do better than what the governmental system can. This is the part A of what I thought. Part B is, since it is the healthcare for industry is the theme, I will, the message that I will like to give through you is that I wish that the message of government going for the insurance sector should be spread widely by the industry to across the entire community through you. The insurance sector in the sense, Tamil Nadu is actually implementing the CM's comprehensive health insurance scheme, which is also combined with the Government of India's Prime Minister's Jan Arogya Yojana, PMJAY scheme, wherein the government actually is giving premium of 849 rupees per person, and we are per family we are contributing. With that, we are giving the health insurance card to the family, for which the treatment up to rupees 5 lakh per year is given free of cost by the governmental schemes. Total 1.43 crore families have been enrolled in the system. Though we have, it is not for the rich people, there is an income limit of 1.2 lakh rupees per annum. But it's okay, per annum, we don't count each and every rupee and all. It's broadly given to the lower middle class families. The card is given. So I will request through you and to your workforce who are of course not in the ESI system to come and enroll for health insurance through the CM's comprehensive health insurance schemes. and thereby ensure that the out-of-pocket expenditure for the families is reduced. In fact, we are having nearly I was just calculating since 2018, for last 5 years, nearly 41 and a half lakh families have benefited out of this. And the government has actually, the government of Tamil Nadu and government of India together are spending nearly 1,800 crores by giving their contribution to the hospitals for treatment of the families every year. So that's the broad system. We will like to further upscale the comprehensive health insurance scheme through the message from the industry and from the hospital care, private healthcare system to all the families. This is the first issue. Second issue which I will like to tell in part B of my presentation is about a scheme called NK47, Namuir or Inuir Kapom, NK47 or IK48, NK48 and MK48 we call it. Mostly we call the abbreviation as NK48. That is Namuir Kapom 48. That 48 mani நேரத்துக்குள்ளே road accident Tamil Nadu எங்கே ஆது இருந்தால் the 108 ambulance வழியாக there are accredited hospitals across the entire state. There are a total of 692 hospitals that are accredited, and that's not just government hospitals, the private hospital also. I believe your hospital might be there also. In most of, for example, Kaveri Hospital is there in the comprehensive insurance scheme. Shankarananthala is in the comprehensive insurance scheme. I have to see, because what we have done is along the roadside major hospitals, private and government, both we have enrolled in the NK48. In that scheme, if there is any road accident and there is a road accident victim, if he is brought to the hospital by anybody, so no questions asked, for first 2 days the treatment to that patient will be done free of cost, and the government will be reimbursing to the hospital in this regard, sir. So the point is that people don't know somebody is lying on the road accident victim. People don't help. One, they might be involved in legal cases. Second, who will bear the expenditure? Doctor vandudan kaas kepange adu onumille. If 108 is asked to call, they automatically will be asked to take to one of these accredited hospitals all across the highways from Chennai to Kanyakumari and to Chennai to Nilgiris, Coimbatore. It is, the hospitals are there. And since 2021, nearly 1.79 lakh persons, road accident victims, have actually benefited from NK48. So let me just tell you, this is the only scheme of such kind in the entire country, which I will like to highlight through you. And a statistical study indicates that the number of deaths because of bringing, they have done previous same time number with now numbers, when they have compared, it has been statistically indicated that the number of deaths have reduced by 7.5% because of the NK48 scheme. I will like you to highlight this particular scheme, and through you, the other person should know that this is a scheme which people can take benefit of. The last point which I will like to highlight is another scheme called MTM, Makkal Thedi Maruthuvam. I have to finish because I have to go over there. I think I am a little long, but I thought I am so passionate about talking to you, and because you are a very important sector for us, is Makkal Thedi Maruthuvam. Makkal Thedi Maruthuvam is a scheme of government wherein we have actually hired women volunteers. They are called Women Health Volunteers, WHVs. In the city, they are fewer in number. In the smaller towns and villages, they are, people know who are WHVs. What they will do is, avanga vandu veed veeda poitu paarpange, makkale vandu avanga two major things they see. One, every family, they come with their kit, BP machine, sugar strips, and they check the sugar as well as BP over there. And generally, a survey has been undertaken which has indicated that 7.5% of our population is likely to have diabetes. 7.5%. Nearly 23% of our population is likely to have hypertension. 10.5% of the population is likely to have both diabetes and hypertension. வந்தவுடன் அவங்க ஒவ்வொரு ஃபேமிலி வரையா அவங்க வருவாங்க, சார் உங்களுக்கு பிபி சுகர் செக் பண்ணுவாங்க. பிபி சுகர் செக் பண்ணிட்டு they are nurses, they are only trained persons. They will ask you to come to the nearest hospital or primary health center. ஸோ உங்களுடைய மெசேஜ் வந்து இப்போ வந்து நம்முடைய நிறைய மாவட்டங்களில் நல்லா ஒரு சொன்னவுடன் they go to the hospital and get confirmed about if they are having BP or diabetes, then they get confirmed and they start the medication. But there are many districts, many cities, urban cities, I do not need to go to the hospital. So the person with BP or diabetes remains untreated. So my message through you and through you to your workforce is that மக்கள் தேடி மருத்துவமோட உமன் ஹெல்த் வாலண்டியர்ஸ் வந்துட்டு உங்களை இதை உறுதிப்படுத்திருந்தால் கண்டிப்பாக நீங்கள் ஆஸ்பத்திரி போயிட்டு அதை உறுதிப்படுத்திட்டு உடனடியாக கவர்மெண்ட் சார்பாக அது மெடிக்கேஷன் சிஸ்டம் தொடங்க வேண்டும். இஃப் யூ ஹேவ் பிபி அண்ட் ஆர் டயபிட்டிஸ் ஆர் போத், and if you start the medication and medication, not only medication, today there is a theme of healthcare, how to cure it with change in the lifestyle, everyday walking. Our honorable minister keeps on doing this health walks, running, jogging. He's a health ambassador. So if you change your healthcare system and you come into the medication system, you can prevent future complications in your lifestyle. I will just like to share with you something that touches my heart is that when I go to the hospitals, the people who have remained untreated for diabetes for a long time, I have seen people lying in the hospitals when I go in the interior areas and with their foot amputated, hand amputated, finger amputated, etc. because untreated, not cared for, ultimately it leads to gangrenes and they have to get it amputation. Of course, now we have got vascular surgeons also who can actually treat all this, but that is also not known to the people. So let us ensure that we put everybody on that alert and about this diabetes and hypertension. Ensure that those people who have been diagnosed with this should come to the hospital, should take medicine, and under MTM, we give 1 month medication through the primary health center or hospital, and thereafter the women health volunteer is asked to go to their house with a packet for the next 2 months. So after 1 month hospital, 2 months mobile வீட்டில் கொடுத்துருவாங்க, அதே பேர் மறுபடியும் 1 month check பண்ணணும். There's a very nice system which Tamil Nadu is having, and we want this system to become a movement in the entire society. That if that be there, we can actually really control all these we call them NCDs in a good way. So this message of the healthcare system, if you spread it, we will be really thankful. And I will end with this. I wish to thank the MCCI for giving me this opportunity, for sharing my thoughts with you, and we wish to have a long association with you. The wonderful work that the Madras Chamber of Commerce has done and the private healthcare system who are representing over here, they have done. We congratulate them and wish to get all your cooperation and help in the future also. Thank you. Anayurukum Ennude Nandri Vanakkam.